Hey, I'm just here to share some of my tips and tricks that I have. These are just some things in my opinion that work the best for me personally. I've gotten a lot of good feedback also from some of my colleagues. So I hope you're able to find one or at least a few that work well for you. Practice is definitely needed to reinforce these. I'll be inserting practice questions throughout the video just to kind of solidify everything. So there is something that I do want to make very clear. Just because you have these test-taking strategies and they can help a lot, that does not mean that you can't be prepared for your exams in terms of the content. I'll say that the knowledge foundation is still the most important part, and that really is the key to be successful for the nursing exams. But these are just some strategies that I have that can help make them a little bit easier. Let's dive in. Arguably, the most important thing with nursing exams is going to be to avoid reading into the question. I have done it, you have probably done it, most of my colleagues have done it. It has to stop. I feel like as nursing students, we are obsessed with reading into the question and assuming things that aren't even there and giving the patient more problems than they already have. We can't do that. You have to trust your instinct and don't change your answer. That is one of the biggest struggles that I feel like nursing students face with these exams, is that everyone wants to change their answer all the time. So you should never change your answer unless you go back and see that you actually read the question wrong. That is the only time you should change your answer. So I will be referring to what is called the stem of the nursing question. So that is the part of the question that gives you all of the details necessary to answer it. It's usually the last sentence in the question. It's really, really important to know what the stem is and where it is and how to read it, because that is really, really necessary in order to answer the question. And also those really, really wordy nursing questions, a lot of that stuff is just kind of there to distract you. So it's really super important to find the stem. And sometimes during these high stress environments, like during nursing exams, we like to rush through and not read every single word and maybe not find where the stem is and not know what the question is really asking. And that is where we run into issues with nursing exams. So something that's really helpful for me is I like to reword it. That way I really understand what the question is trying to ask me. So the first step is going to be to identify if the question has a negative polarity to it. So nursing questions usually have a positive polarity, which means it's asking you the question and you answer appropriately. But there will be a keyword in there that actually changes the entire meaning of the question. So it's like the difference between asking the client has understood the teaching when they state this versus the client has not understood the teaching when they state this. It's almost like you're looking for the false answer. So inside of that stem, there's going to be a key word that will make it a negative polarity. Those are going to be words like not, accept, never, contraindicated, unacceptable, avoid, unrelated, violate. So if you see any of these words in the stem, that's how you know it has a negative polarity. So if we are rushing through an exam and not reading everything carefully, we can miss that key word and possibly answer the question incorrectly. So here's an example problem that I have. It reads, a client is receiving a low-sodium diet. Which food should the nurse teach the client to avoid because it is high in sodium? So the stem of the question is going to be this last sentence where it states, which food should the nurse teach to avoid? So right away we see the word avoid, so we know right off the bat this question has a negative polarity. This is also one of those examples where the first sentence of the question has nothing to do with what you need to know to answer the question. It's almost kind of there to throw you off, and those are the sentences that can make you overthink. So don't even think about that, just focus on the stem. So I'm going to reword this question in my head so I know how to answer it better. Essentially, this is asking me what the client needs to avoid because it's high in sodium. A, stewed fruit. B, luncheon meats. C, whole grain cereal. D, green leafy vegetables. So tapping into the knowledge base here, we know that luncheon meats are high in sodium and in fact should be avoided for somebody on a low sodium diet. The second thing we're going to be talking about is finding the word inside of the stem that sets a priority. These, in my opinion, are the hardest nursing questions. One thing to keep in mind with priority questions, most, if not all of the answers are going to be correct, but we need to find the one that is the most correct in this specific scenario. So those keywords you need to look for are priority, first, initially, best, safest, and most. Those are all words that would set a priority in a question. The hard thing with these priority questions is that we have a few different ways that we can prioritize. The first way to prioritize is going to be using the ABCs, the airway, breathing, circulation method. So a person cannot live without the ABCs present, which is why that's a pretty easy thing to identify in questions. Here is an ABC priority question that I have. A client is admitted to an emergency department and a diagnosis of mixed edema coma is made. Which action should the nurse prepare to carry out initially? Right away I see that word initially, we know, okay, we are going to prioritize. So you have to read all of the answers and then decide which way you need to prioritize. A, warm the client. B, maintain a patent airway. C, administer thyroid hormone. Or D, administer fluid replacement. I can see that letter B has the word airway in it, and when I read it back, maintain a patent airway, that tells me that this is going to be an ABC priority question. So again, that entire first sentence is not actually completely necessary to answer the question. You could not even know what a mixed edema coma is, and you would know that without a patent airway, it doesn't really matter what type of problem the patient has going on. That is the most important priority. You should also keep in mind that these answers, most of the time, all of them will be in some way, shape, or form a correct intervention of what is being asked, but we still have to set the priority. So that is how you answer the mostest, bestest, correctest answer. Another way we can prioritize is using Maslow's hierarchy of needs. You always want to make sure that you address these bottom physiological needs before you can even move on to the next level. This question reads, the nurse developing a plan of care for a client with a cataract understands that which problem is the priority? A, concern about the loss of eyesight. B, altered vision due to opacity of the ocular lens. C, difficulty moving around because of the need for glasses. Or D, becoming lonely because of decreased community immersion. So looking at those answers, I can see a trend with Maslow's. Two of them are more psychosocial needs. I'm talking about letter A, concern about the loss of eyesight, and then D, becoming lonely because of decreased community immersion. Yes, those things are important to address with the client, but those aren't the priority right now because those are the higher up levels that we need to address later. But letter B, altered vision due to opacity of the ocular lens, relates to a safety issue. If the opacity of the lens is altering the vision, that would be a priority before the psychosocial needs. So that is how I'm able to determine that is the most correct, best answer. The nursing process is actually a very, very helpful way to prioritize answers. So we have the nursing process. We know that we are going to assess before any of the interventions, and we also know that we're not going to evaluate before doing any other steps of the nursing process. So that can be a really, really helpful tool to help prioritize. So when I read all of these answers, it sounded like assessments, interventions, and evaluations. So then I would go back, look at all the answers again, and determine where on the nursing process it fits. So A, give dextrose water, that's an intervention. B, call the physician immediately, that's an intervention. C, determine blood glucose level, that would be an assessment. And then D, observe closely for other symptoms, that's more so evaluation. So that's how I'm able to select the correct answer, which is determine the blood glucose level, because you have to assess before you do any of those interventions. Determining if a problem with the patient is acute or chronic can also be really, really helpful in prioritizing. So the questions that ask which patient is the priority, you want to think about which patient is more acutely ill or chronically ill. Another way you can think about it is this expected of this patient or is it not expected of this patient? Those can be really, really tricky, especially when talking about COPD patients. So let's say that a COPD patient has an oxygen level of 89%, and you think, oh my gosh, that's out of range, that's the priority. Think about, okay, an oxygen level of 89% is actually expected for somebody with COPD, so there might be a more correct answer. You also want to keep in mind how invasive or restrictive an intervention could be. So you would always want to do everything that is the least invasive or the least restrictive before implementing more invasive or more restrictive procedures. I always think about the fact that you would want to place an ECG on a patient before you do open heart surgery. I don't know why, but that one for me has been extremely helpful. The last priority that we're going to talk about is determining what would be the most client-centered option. So as nurses, everything revolves around the client. So we'd want to pick the option that best suits them or is best centered around the client. This question reads, what should the nurse do first when combing a female client's hair? So I see the word first in there. That's how I know I'm going to prioritize. A, use tap water to moisten the hair. B, apply a hair conditioner before combing. C, comb the client's hair using long strokes. D, ask the client how she prefers to wear her hair. So before I knew these strategies, I would read that question and literally think to myself, what in the actual heck am I supposed to do? How am I supposed to answer this question? Like, that all sounds perfectly fine. How is there even a priority in that? And that's why it's really helpful to remember that the things that we do need to be client-centered. So looking back at the answers, the only answer that has anything to do with what the client would prefer would be D, ask the client how she prefers to wear her hair. That answer is the most client-centered, which is how I'm able to determine that that's the first thing we want to do. So we've talked about some things that we can find inside of the actual question itself to help us, but there are a few things that we can look at that are inside of the answers. So that being said, one thing that we can do is identify any words inside of the options or the answers that are closed-ended words. So those are words like only, always, never, every, all. Those make the answer definite, like there's no wiggle room, it is what it is. But I will say, most of the time, because not all the time, there are exceptions, but most of the time you can eliminate those options. So an exception to something like that would be if the answer is we treat all clients with respect, because we know that we do. But you should be able to identify whether or not it is an exception. This question states, a client is to undergo a CT scan of the abdomen with oral contrast, and the nurse provides pre-procedural instructions. The nurse instructs the client to take which action in the pre-procedural period? A. Avoid eating or drinking for at least 3 hours before the test. B. Limit self to only 2 cigarettes on the morning of the test. C. Have a clear liquid breakfast only on the morning of the test. D. Take all routine medications with a glass of water on the morning of the test. So just from reading those answers, I noticed a closed-ended word in 3 of the 4 options. So we go back and look. B, we have the word only. C, we have the word only. And D, we have the word all. And I know that I can eliminate those options, so we're left with one answer. Now we're going to talk about how we identify options that are opposites from each other. So in a multiple choice question, if you have 2 answers that are opposites, most of the time one of them would be your answer, and the opposite answer is used as like a distractor. This question says, anti-embolism stockings are prescribed for a client. When should the nurse apply the anti-embolism stockings? A, while the client is still in bed. B, once the client reports having leg pain. C, when the client's feet become edematous. D, after the client gets out of bed in the morning. I noticed that A and D are essentially opposites of each other. A is saying that the client still needs to be in the bed, and D is saying that they need to be applied after the client gets out of the bed. So this is a great example why we can't just solely rely on these strategies, and you do have to have a knowledge base because we are trying to pick between these 2 answers. I'm able to answer this question because out of those 2, I know that we need to apply those stockings while the client is still in bed. So although it won't give you the correct answer 100% of the time, it still narrowed down my choices from 4 to 2. So kind of on that same topic of 2 options that can be opposites, we also need to be able to identify when 2 options are really similar. I like to think the fact that they're comparable or they're alike. The answers won't be saying the exact same thing, but an easy way to identify if 2 answers are similar is that we can use what's called the if-then method. So I would look at all the options and I would say, okay, if I perform this intervention, then what would be the outcome? 2 answers that are going to be comparable or alike would have very, very similar outcomes. Most of the time, we can eliminate those 2 similar options. How can the nurse promote circulation when providing a back rub? A, place the client in the prone position. B, use moisturizing cream. C, apply carrier lotion. D, knead the skin. Right away, I kind of see that the moisturizing cream and the lotion are really similar, so then I would use the if-then statement to try to see how similar they really are. So I would think to myself, if I use moisturizing cream, then that would hydrate the skin. If I apply carrier lotion, then that would also hydrate the skin. So I can go ahead and eliminate those options because they are very, very similar. We can only pick one answer with multiple choice, so we can't pick both of them. So going back to the question, I'm now left with 2 answers. That's when I use my knowledge to know that placing a client in the prone position would have nothing to do with promoting circulation, but kneading the skin would. Finding options that are opposites and options that are similar can also be really helpful for those wonderful select all that apply questions that we all know and love so deeply. If you have 2 options for select all that apply that are opposites of each other, you know that you are either going to pick one of those options or neither of them. If you have options that are similar with select all that apply questions, you know that you would pick both of them or neither of them. So that's been really, really helpful to help me answer those as well. This question asks, a nurse is following the progress of a client being treated for hypothyroidism. Which findings indicate that thyroid replacement therapy has been inadequate? Select all that apply. So this one is a little extra tricky because the word inadequate actually makes it a negative polarity question. So essentially this question is just asking what are the signs and symptoms of hypothyroidism because the treatment was inadequate. That's a really good example that shows the importance of being able to tell the polarity of a question or not. A. ECG changes. B. Tachycardia. C. Low body temperature. D. Nervousness. E. Bradycardia. Or F. Dry mouth. So right away I see that B and E are opposites of each other. In a select all that apply question, you can't pick two options that are opposites. It just doesn't make any sense. So that's when I really have to use my knowledge to know that, okay, hypothyroidism, you're going to have bradycardia. So I can go ahead and eliminate the option that is opposite of that. After that, I noticed that B and D are also kind of similar. I associate tachycardia with nervousness. So that's really helpful in order to eliminate that option as well. Looking at the other options, I know that ECG changes would also indicate that the thyroid replacement therapy has been inadequate. So using these techniques on select all that apply questions can save your life. Another technique that's really helpful is to be able to identify if there is a global option or just a more broad option. I think of that as like an umbrella term where the other answers could be correct, but they would fall underneath that umbrella term, and that umbrella term would cover essentially all the other options. So looking at this question, a client admitted to the hospital is diagnosed with a pressure injury on the coccyx with a wound vac. The wound dressing and wound vac foam is due to be changed. The nurse should employ which protective precaution to prevent contraction of the infection during care? Beautiful example of a super wordy question that has nothing to do with what the question is actually asking you. Let's go back and look. The nurse should employ which protective precaution to prevent contraction of the infection during care? A. Gown and gloves. B. Gloves and a mask. C. Contact precautions. D. Airborne precautions. If you look at A and B, gown and gloves, gloves and a mask, those fall under contact precautions. So that's how I'm able to determine that contact precautions is the umbrella term. Then I have to tap into my knowledge to know that we're not going to be using airborne precautions when we're doing wound dressing changes. That concludes all of the test-taking strategies that I have. I got these practice questions from comprehensive NCLEX books. I'll put those in the description. I just want to reiterate that in order to be the most successful in nursing school and on these exams is that you have to have the knowledge. As much as these strategies will help you, you still have to really know and understand the content. I'll actually be making some more videos that go over some tricky content and just some really helpful things that help me memorize and remember and understand some of that stuff. I also just want to say that I know the world is a very scary and terrifying place right now, and I know that it's traumatized so many people, and I hope that you are staying safe, take care of yourself, your loved ones, and happy studying.